Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us here on Health Professional Radio once again. In this segment, we're going to have a conversation with Jenn Tardy, inclusive recruiting expert and career coach, and also Dr. Merle Diamond, president and medical director at Diamond Headache Clinic. They're joining us to discuss migraine and findings from a recent Harris Poll survey titled Working Through Migraine. Welcome to Health Professional Radio, both Jenn Tardy and Dr. Merle Diamond. Thank you both for joining us this morning.
Thank you.
Thank you.
Jenn, tell us a bit about yourself. I did tell our listeners what your title was. Give us a little bit of your professional background. And Dr. Diamond, if you would do the same.
Well, thank you for having us. So I'm Jenn Tardy, and I've been in the world of recruiting for the last 15 plus years. And most recently, I own a business called Jennifer Tardy Consulting, where we not only work with employers to create effective diversity recruiting programs and more inclusive companies, but we also work with people who are on their job search to help them to navigate bias to land great jobs and get promotions.
And Dr. Diamond.
So I am the director of the Diamond Headache Clinic in Chicago, and we take care of patients who have migraine and other headache disorders. We've been doing it for about 60 years. Not me personally, but we've been around about 60 years.
Dr. Diamond, what is migraine? What are some of the symptoms, and how is it different from, well, for lack of a better term, a regular headache?
Right. Well, the truth is you're never supposed to have a headache, so there aren't regular headaches.
Okay.
But typically migraine is a severe, throbbing, pulsatile pain that causes significant disability, often associated with nausea, sometimes vomiting, and light and noise sensitivity. So a lot of our patients require bed rest when they have it, or at least need to take time to treat their specific attacks. And that's why sometimes having preventive therapy is very important.
Migraines affect many people and has, what I understand, a significant impact in the workplace. Could you give us some insight into that?
Yeah, as a matter of fact, migraine disease is the second leading cause of disability in the world. And that's why we're so glad to be partnering with AbbVie, who sponsored a survey of 1,000 people in the U.S., ages 18 plus, living with migraine disease and just its impacts in the workplace. And so one of the things that we know is that it impacts individuals and it deeply impacts the workplace as well, too. One of the messages that we're trying to get out today is that it does not have to be this way, and that there are things that employees can do to work with their employer to create more migraine-friendly workplaces.
Doctor, before we get into the survey that Jenn mentioned, are there any preventive treatments?
Yes, there are preventive treatments for migraine, which are really important to reduce the frequency of the attacks. Qulipta is a medication that can be taken once a day in adults for episodic migraine. And it can reduce the frequency of attacks by more than 50%. It is associated with sometimes some nausea, sometimes some constipation, and maybe fatigue. But again, for at least a third of our patients, having preventive therapy can be really, really useful. And that's why Jenn and I are partnering with AbbVie to look at the impact of migraine in the workplace.
Jenn, you mentioned a survey. Could you tell us about this Harris Poll survey, Working Through Migraine, some of the key findings, if you would?
Absolutely. So one of the key findings is that 78% of the individuals who responded to the survey said that they experience presenteeism, which means that they're present at work but just not as productive when migraine attacks happen. And 74% mentioned that it's difficult to manage their migraine at work. And then there was 66% that said it just feels like there's this stigma that is attached to when they need to call out or not be present that day at work. And even 1 in 4 individuals mentioned that they've had to make some long-term adjustments at work, like switching career paths or even or switching career paths due to long-term migraine attacks. So those are some of the survey results that really stood out to us.
Doctor, who's affected by migraine? Is this something that knows no age or gender or race? Is anyone susceptible to migraine?
So migraine is often a genetic disorder, and it impacts women about 1/5 of the female population in the United States has migraine, about 7 or 8% of men. And so it does preferentially impact women. The important thing is that we know a lot more about it. It's been misunderstood for years, and we have a lot more information today and really good therapies available to patients.
Jenn, were the survey participants indicative of the population that Dr. Diamond just described? Was it mostly women, or was it a mixture of many types of people?
I can tell you that in the U.S. it was people 18 plus. And I also can share with you, too, it's very interesting, something that Dr. Diamond mentioned a second ago, but the window during which people experience migraine the most is between 25 and 55. And what's interesting about that is that this is also the time when they're in their most productive working phase. Isn't that interesting?
So it's not a stress thing. You say it's an inherited thing?
Right, but migraine has many triggers, and one of them can be stress. I like to use the word overstimulation rather than stress because, again, it sort of puts a burden on the migraine patient that they can't manage. And that's just not the case. They just have a very sensitive nervous system.
Are there any symptoms to say that an attack is coming? You say overstimulation, not necessarily negative or positive stimulation, just overstimulation. Are there any warning signs that, hey, today's going to be a bad day or not?
Well, so there is something called prodrome where patients know that it's going to be a headache day and they may have noise sensitivity or irritability or fatigue that even precedes their attack. About 20% of patients will have an aura or visual stimuli and most often it's visual, that tells them attack is coming imminently. But again, having good therapies is super important.
Jenn, are workplaces not migraine friendly? And if not, how do you make them migraine friendly and start these conversations with your boss or your coworkers, if necessary, about the condition that you're dealing with?
So about 30% of the survey respondents mentioned that their workplaces are not migraine-friendly workplaces. And let's put this in a grander perspective. Migraine attacks at work is a $19.3 billion issue where when you really look at the indirect cost, 81% of that goes to absenteeism, right? And so we like to talk to people today about having courageous conversations and with your employer, because that is how you begin to initiate more migraine-friendly workplaces. And some of the accommodations that you could seek when you're talking to your employer include soft lighting. It includes a designated quiet area, paid sick leave, or even time off. And one of the things that I just want to re-emphasize is that you're not alone if you're experiencing migraine in the workplace, because, again, it's the second leading cause of disability in the world. And so whether you're speaking up for yourself or for one of your peers, having the courageous conversation is what's most important here.
Doctor, where can our listeners learn more about migraine?
You can go to qlipta.com or 1-855-QLIPTA.
Jenn Tardy, Dr. Merle Diamond, thank you so much.
Thank you.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Jenn Tardy and Dr. Merle Diamond. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.